Okay, let's unpack this. Imagine someone tells you that the common sense cure for dehydration could actually be the very thing that becomes deadly.
Hmm.
It's a surprising twist, isn't it? Today, we're diving into a topic that, well, at first glance might seem pretty specific to livestock salt toxicity in cattle.
Right.
But trust me, this deep dive reveals some really profound insights into animal physiology, the critical importance of water management, and maybe most surprisingly, how our own instincts about fixing a problem can sometimes, lead to disaster.
Absolutely.
We're exploring a condition known as sodium ion toxicosis, or hypernatremia. And the usual suspect, just too much salt, that's actually only half the story.
Yeah. Often the smaller half, really.
The more common and often overlooked cause involves something far more fundamental:
Mm.
water, or the dangerous lack of it.
Exactly.
So we've pulled together insights from some comprehensive reports on salt toxicity in cattle. We're covering everything from the intricate mechanisms inside the brain to practical prevention strategies out on the farm. Our mission: to arm you with the knowledge to truly understand this condition, not just what it is, but why it matters and how it's managed, especially that counterintuitive cure. So when we talk about salt toxicity in cattle, it's rarely as straightforward as an animal just eating too much salt.
That's right.
While that can happen, our sources consistently show that this condition, often called hypernatremia or water deprivation, sodium ion intoxication, is more commonly a disorder of water metabolism.
That's a critical distinction.
Yeah.
Yeah. What's truly fascinating here is the sort of dual nature of its causes.
Okay.
On one hand, you do have direct sodium ion toxicosis from an acute excessive intake of salt, sure.
Right.
But far more frequently, what we see is indirect or chronic sodium ion toxicosis. And that arises from restricted water intake even when the salt levels in the diet are completely normal.
Huh. Even with normal salt.
Even with normal salt. And this leads to severe neurological dysfunction, high mortality rates, which translates directly to significant economic losses for producers.
Yeah, I bet.
We're talking about direct animal deaths, reduced productivity, increased management costs, and, globally, the impact is immense. Salt-induced land degradation alone, just that, accounts for billions of dollars annually in lost crop production,
Right.
which, indirectly impacts livestock by reducing the availability and quality of their feed. It's all connected.
So if it's not always just about too much salt, what are the main ways this silent killer gets started? Our sources point to two main routes, right? With that second one being the more common culprit.
Exactly. The first one is indeed excessive sodium intake.
Okay.
This can happen from improperly formulated feeds, or if animals that have been salt deprived suddenly overconsume salt-limited feeds.
Right, they gorge on it.
They gorge on it. Think about feed formulations where high concentrations of salt, sometimes up to like 13%, are intentionally used to regulate an animal's intake.
Right, to slow them down.
To slow them down. Now, while that can be effective, it demands extremely careful management and continuous unrestricted access to plenty of fresh water. That's the key. Always the water.
Always the water. Even less obvious sources like whey as a feed component can significantly contribute to sodium intake.
Didn't think of that.
Yeah. Then there are natural water sources like high saline groundwater, or maybe accidental access to industrial waste, or even just overflowing loose salt boxes out in the pasture.
But what the sources also highlight, and this might surprise some people, is that the main cause often isn't the salt itself, it's the lack of water.
That's the big one, yeah.
We're talking about practical issues, right? Like mechanical failures in watering systems.
Broken pipes, pumps failing.
Frozen water lines in winter.
Classic problem.
Overcrowding at the trough, maybe, or even water that's got medication in it and it tastes bad, so they just won't drink it.
Unpalatable water, exactly. Or even the stress of transport, hot, dry conditions stuck in a truck.
Yeah. The reports emphasize that in really hot weather, even just 24 hours without water can be enough to trigger this condition.
It can happen fast in those circumstances. So this raises an important question. Who is most susceptible? Is it all cattle equally?
Good question. All livestock species can be affected, but their tolerance levels, they do vary. Pigs are generally the most susceptible. Sheep, interestingly, show the highest tolerance.
Huh.
Horses and cattle fall somewhere in between.
Right.
Lactating cows and young animals, like calves, they're particularly vulnerable.
Why is that?
Well, for lactating cows, it's their higher water requirements for milk production. Makes sense.
Right.
For calves, it might be partly due to lower plasma protein concentrations, which can make their fluid balance a bit more delicate. We even see cases in calves reported just from incorrectly mixed milk replacer, too concentrated.
Oh, wow. Simple mistake, big consequence.
Exactly. Also, animals not used to high salt diets are at significant risk if they suddenly get free access to salt.
Okay, so acclimatization matters.
It matters a lot. But if we connect this to the bigger picture, cattle actually have a remarkable tolerance for high salt in their diet,
Here it comes.
provided they have continuous and unrestricted access to fresh water. The fundamental issue, almost always, is a dangerous disruption in that water-to-sodium ratio, rather than just an absolute excess of sodium.
Okay, knowing how animals typically get into this situation, let's turn to the why it's deadly part. What precisely is happening inside the animal's body that turns this imbalance into such a crisis?
Right. So the initial event is an increase in serum sodium. That's what we call hypernatremia, basically. Too much salt in the blood.
Okay.
This creates an osmotic imbalance. Think of it like water wanting to dilute the saltier area.
Right, osmosis.
Exactly. So water gets drawn out of the body's cells, especially the brain cells, to try and dilute the salty blood. This leads to cellular dehydration and, crucially, neuronal damage. The brain literally shrinks.
Shrinks. Wow.
It can pull away from the skull, potentially tearing small blood vessels in the process.
That's already pretty dramatic. But what's truly remarkable, almost counterintuitive, is the brain's own defense mechanism, right?
It is remarkable. To cope with this sustained hypernatremia, the brain cells start to develop what are called idiogenic osmoles.
Idiogenic osmoles.
Right, these are special organic compounds, things like taurine, mannitol, glutamate. They act like tiny internal magnets inside the brain cells
Do what?
to draw water back into the cells to counteract that shrinkage and maintain the cell volume. It's an incredible adaptive response to a very dangerous situation.
Okay, so the brain fights back. But you said this sets the stage for the most dangerous part?
Indeed it does, because this protective mechanism, while initially life-saving, sets up the most critical and often fatal phase. This paradoxical danger happens when animals with chronic hypernatremia, the ones whose brains have built up these idiogenic osmoles,
Right.
are suddenly given unrestricted access to fresh water.
The cure.
The apparent cure. What happens is that rapid rehydration causes the sodium levels in the blood serum to drop very
Wow,
quickly.
that sounds good.
It sounds good, but those idiogenic osmoles inside the brain cells, they dissipate much, much more slowly. It can take 48, even 72 hours for them to clear out.
Oh, so there's a lag.
A huge lag. And this creates a severe reverse osmotic gradient. Now, water rushes into the brain cells because the inside is suddenly saltier or more concentrated relative to their rapidly diluted blood.
Oh, no.
This causes profound cerebral edema brain swelling, a dangerous increase in pressure inside the skull, acute encephalopathy. This rehydration-induced brain swelling is the primary cause of the severe neurological signs and the really high mortality rates we see.
So the attempt to fix it quickly actually causes the fatal event.
Precisely. The paradox. And beyond the brain, that excessive salt can also irritate the gut, cause blood cells to break down, leading to dark urine, and even cause acute kidney damage.
Wow, okay, with such severe internal things happening, what does salt toxicity actually look like in cattle? Are there clear, obvious signs, or is it more subtle, more hidden?
It can vary quite a bit. In acute salt toxicosis, say from a massive sudden ingestion, the signs can appear really rapidly, sometimes leading to death within 24 hours.
That fast.
That fast. More commonly, though, with the water deprivation scenario, the signs emerge more gradually, maybe after 4 to 7 days. And often it affects multiple animals in a herd.
Right.
This is why it's often called a silent killer, because those initial signs can be subtle, easily missed until it's too late.
So if I'm a producer or just someone observing a herd, what's maybe the subtlest behavioral change that should immediately make me think salt toxicity, rather than, say, just an off day or a simple stomachache? Is there a specific pattern?
That's the real challenge, especially with the water deprivation form. It often starts subtly. Early indicators might just be general depression, some weakness, maybe a lack of coordination, what we call ataxia, and maybe some fine muscle tremors.
Okay, still kind of general.
Kind of general, but as it progresses, you'll see more obvious signs. Staggering, head pressing against fences or walls.
Head pressing, okay.
Circling. And here's a crucial differentiating sign. blindness.
Blindness.
Acute blindness, often without other obvious eye issues, that's a strong red flag. It can help distinguish it from some other neurological conditions like polio or lead poisoning, which might have some similar initial signs, but maybe not that sudden blindness.
Got it. Blindness is key.
It's a very important sign. In advanced cases, seizures are common, leading to the animal being unable to stand, falling into a coma, and eventually death. You might also see opisthotonus, that's an arching of the neck and back,
Right.
compulsive walking, or even animals becoming suddenly belligerent and aggressive, very out of character, along with subtle things like dragging their hind feet.
So behavior is key for early warning.
Absolutely. Aimless wandering, that head pressing, constant chewing motions when they're not eating, or that uncharacteristic aggression, especially if you know there's been any history of potential water restriction. Those are critical flags. Need timely intervention.
And beyond the brain stuff, the neurological signs, are there other physical things we might see?
Yes. Gastrointestinal signs are also pretty frequent, particularly with acute salt ingestion.
Like what?
You might observe increased thirst, obviously excessive salivation, maybe vomiting or regurgitation, abdominal pain, and often this kind of green, watery diarrhea.
Okay.
Other general symptoms can include things like sunken eyes, maybe a swollen anus, sweating, dilated pupils, muscle twitching, a rapid heart rate, and even dark urine from that hemolysis we mentioned.
All right. So if we suspect salt toxicity based on these signs, some of which overlap with other conditions, what's the definitive way to confirm it? What are vets actually looking for in the lab?
A comprehensive approach is really crucial. You have to integrate the animal's history, especially water, and feed access history. That's paramount, with a thorough clinical exam and then the lab diagnostics.
Yeah.
For lab work, elevated serum sodium levels typically above, say, 160 milliequivalents per liter, MEQL, are indicative.
160.
Yeah. And this is a big, but it's important to note that these levels can rapidly normalize once water is provided.
So you can miss it.
You could miss it. It could lead to false negatives if you test too late after they've had a drink. Cerebrospinal fluid, the CSF sodium concentrations, also above 160 millieql, they show a similar pattern. Can drop quickly.
So what's considered the gold standard then? Especially if animals have already been rehydrated, or maybe if we're looking at post-mortem samples.
Brain sodium concentration. That's considered the definitive diagnostic test.
Why the brain?
Because brain sodium levels equilibrate much more slowly than in the serum or the CSF.
Yeah.
It makes it a much more stable and reliable indicator, especially in those post-rehydration situations or post-mortem.
Makes sense.
Concentrations exceeding 2,000 parts per million, ppm, on a wet weight basis that's considered diagnostic in cattle and swine. You need fresh, homogenized brain tissue for that test.
Okay.
Ocular fluid analysis from the vitreous or aqueous humor, the fluid in the eye, that's also very valuable post-mortem. Sodium levels there are also more stable during those post-mortem changes. Yeah, and while a post-mortem exam might show signs like brain swelling or maybe some stomach irritation, often the gross lesions, what you can see with the naked eye, are nonspecific or even absent.
So you really need the lab work.
You really need the lab confirmation. And the importance of multi-sample confirmation, looking at several things, can't be overemphasized. No single test is perfect for all situations. Relying only on serum or CSF can definitely lead to false negatives. So putting together the clinical history, the brain sodium analysis, maybe ocular fluid, that gives you the most robust and reliable diagnosis.
Okay. Given everything we've discussed, the causes, the deadly mechanism, the signs, what are the key strategies for preventing this? And crucially, for treating it? This is where that paradox really hits home.
Prevention is absolutely paramount. It's always better than treatment here, especially since water deprivation is the most common cause.
Right.
So the most fundamental, most effective measure is just providing continuous free choice access to clean, fresh water. Seems simple, but it's critical.
Simple but essential.
Absolutely. And beyond just access, routine monitoring of water quality is crucial too.
What are we looking for in quality?
We're talking about testing for total soluble salts, or TSS. Water with less than a 1,000 ppm TSS, that's excellent. Over 10,000 ppm, definitely unsafe.
Okay.
Sulfates above about 150 ppm can give water a salty taste they might not like. And high concentrations over 2,000 ppm can act as strong laxatives.
Even temperature.
Even water temperature matters, yeah. Cattle generally prefer water between about 40 and 65 degrees Fahrenheit.
And what about managing salt in the feed? You mentioned it can sometimes be intentionally added. How do we prevent issues there?
Exactly. If salt is being used to limit feed intake, it has to be done with extreme caution.
Yeah.
Cattle can tolerate high concentrations, like we said, up to 13% in feed,
Right.
but only if fresh water is continuously and consistently available. No interruptions.
Got it. Constant water.
Constant water. It's also important to avoid using trace mineralized salt in those high salt mixes to prevent other potential toxicities, like copper maybe.
Right. Good point.
This just highlights a crucial point. Nutrition and hydration management, they have to be treated as integrated systems.
Yeah.
You can't just change one without thinking about the other. Any change in feed, especially involving salt, must be immediately matched by a reevaluation and reinforcement of the water access protocols.
Okay. Now, the really tricky part. Treatment. If an animal does show signs, what's the right approach? This is where that core paradox lies. It sounds so simple, give a dehydrated animal water.
Yeah.
What's the common, potentially fatal mistake a well-meaning person might make right after discovering a water-deprived animal?
Well, first, the prognosis. Once those severe signs are evident, it's guarded to poor. Mortality rates are high, often exceeding 50%.
Wow, okay.
The most critical step in treatment, and this is the absolute key, is slow rehydration.
Slow.
Slow. This is precisely where the counterintuitive part comes in. That rapid rehydration, letting them drink all they want immediately, that's what causes the fatal cerebral edema, the brain swelling.
So you have to hold back.
You absolutely have to hold back. Water intake must be strictly limited. Offered perhaps at about 0.5% of the animal's body weight, maybe at hourly intervals, spread over several days. Days, not hours.
0.5% of body weight per hour. That's not much.
It's not much at all. The goal is to allow those serum sodium levels to drop slowly, carefully. The target rate for lowering serum sodium is maybe only 0.5 to 1.0 millieql per hour, and you want the slower end of that range for chronic cases.
Okay. Very slow adjustment.
Very slow. Veterinarians might use hypotonic fluids like 5% dextrose administered slowly intravenously. And then there's supportive care seizure control with drugs like diazepam, maybe anti-inflammatory medications to try and reduce brain swelling, and just careful nursing care for animals that are down.
So the critical counterintuitive takeaway is that immediate unrestrained water, your natural instinct, is precisely what you must avoid.
Exactly. It's not just about giving water, it's about how you give it and the rate, the incredibly slow rate at which you bring the body back into balance.
So there you have it, a deep dive into salt toxicity in cattle. What started as maybe a seemingly specific animal health issue has really peeled back layers, hasn't it? Revealing fascinating insights into the body's delicate osmotic balance, the surprising, deadly consequences of even well-intentioned rehydration,
The paradox.
and the critical importance of looking at things like feed and water as integrated systems. It's a powerful reminder that sometimes the simplest solutions, like just consistent access to quality water, are actually the most profound.
Indeed. This condition really underscores that knowledge is most valuable when it's deeply understood and crucially correctly applied. For you, the learner, this case study is, I think, a prime example of how complex biological systems respond to environmental and management pressures, and why critical thinking is just so essential in this world of information overload.
It really makes you think, doesn't it? About all the unseen battles happening inside an animal. It's almost like the body has its own, complex emergency response team. But even they can be overwhelmed, or in this case, their own defense can set up the final problem.
Well put.
So how does this deep dive shift your perspective on what it means to be truly well-informed, even on topics you maybe never expected to delve into? It's about recognizing the interconnectedness, isn't it, of seemingly disparate factors, and understanding that a seemingly obvious solution might in fact be the very opposite of what's needed. Keep asking those questions, keep digging, and keep connecting those dots.